Hi friends, this is Dr. Kadam Nagpal, Senior Consultant Neurologist from PSRI Hospital. So today I shall be talking about air pollution and the risk of stroke. So as we understand that we are approaching winter and we are seeing that the air quality is getting poorer by day because of underlying air pollution post Diwali and because of the vehicular pollution. So simultaneously we have to understand that there is always an increased risk of stroke, which is being often seen because of winters, and there have been trials and researches which prove that even air pollution increases the risk of cardiovascular diseases as well as strokes. So the most harmful component in air pollution is the PM 2.5, which is basically released and emitted from the fossil fuel burning which is being done in cars, in bikes, as well as from the trains. So because of excessive fossil fuel burning, there is a PM 2.5 in the atmosphere which gets inhaled very easily, and it mixes up in the bloodstream and results in decreased oxygenation, hardening of the blood vessels, and increased blood pressure of the patients as well, which thereby manifests with increased risk of stroke. Although we have to understand that there is always a consideration that air pollution might be a risk factor for stroke, but the pathophysiology behind it is still very uncertain. But yes, there have been trials, there have been researches which prove that air pollution is basically is being associated with increased incidence of stroke. So as we understand that we have to be gearing up because winters are there around the corner, and in the winters there would be increased air pollution, so it will be the increased risk in stroke. So we have to understand what basically are the risk factors of stroke. So the risk factors of stroke are basically advancing age, increased blood pressure, uncontrolled diabetes, abnormal cholesterols, smoking, physical inactivity, abnormal lifestyle related problems, as well as excessive alcohol consumption. So alongside, we have to understand that there is an additional risk factor in terms of increased air pollution. So we have to be very cautious about the signs and symptoms of stroke. We often sensitize our patients where we just let them know that there is a mnemonic called as B fast. So B, any kind of difficulty in balancing. E is for any eye signs or difficulty in the vision or disturbances in the vision. F is for facial droop. A is for arm weakness. S is for slurred speech, and T, that is the time to act. So you need to just bring the patient to a nearby emergency facility wherever there is a stroke unit or neurosciences department in place, so that immediately attention can be brought to such a dreadful ailment. So basically, whenever the patients do come in, first 3 to 4.5 hours, we call it as the golden hour of stroke, because there is an option of using a clot bust injection to dissolve the clot, and then there is an option as well to retrieve the clot through an intervention process. So if we are able to do both these procedures, there is a high likelihood that the patient might benefit from the stroke very significantly, thereby reducing the disability and further mortality and deaths associated with stroke. So we have to be very careful regarding knowing about the risk factors, treating them well, and knowing about the symptoms of stroke. As far as air pollution is concerned, we have to, whenever the air quality outside is very poor, that means the particulate content in the atmosphere is very significantly high. Then this is the time that we have to just curtail our outdoor activities, avoid the outside morning walk, be indoors, try to use a mask, and we have to just be very cautious and very well aware that excessive exposure to the pollution also might be just increasing the risk of stroke. Thank you.